This is critical thinking in the circulation and cardiovascular physiology lab. And let's look at some of the questions here. So the first few are on circulation. So this is fetal circulation. This question is on fetal circulation, and these are the choices. The next one again on circulation, where you have to identify a vessel and then say what is it a branch of. Then again, identify, you have to talk of two vessels which drain into this one. Here again is a bit of circulation and physiology, where you identify the vessel and then say what would happen if there was atherosclerosis. And this is on physiology, something to do with cardiac output. And here again on physiology, and this takes into account the cardiac cycle. So if you notice, cardiac cycle is really important. Let's come back here, and then it asks you what kind of blood is carried in blood vessel A, and A, which you see up here, is the ductus venosus. So it's the ductus venosus which connects two veins, and you can see that it is bringing blood from the placenta. And what this ductus venosus does is it connects the umbilical vein with the inferior vena cava, and this carries oxygenated blood, because remember, the umbilical vein is, this one is the umbilical vein. The umbilical vein is different from other veins in the body because it's carrying oxygenated blood. So it's very similar to the pulmonary vein. And here, this portion here, just this bit here, is where the ductus venosus connects the umbilical vein to the inferior vena cava. So that also therefore will carry oxygenated blood. Once it goes into the inferior vena cava, then the blood is mixed. So inferior vena cava carries both oxygenated and deoxygenated. So now let's look at the next picture, where look at the clues given. It says identify the vessel the arrow points to, and then it says what is it a branch of. Now whenever you get something like that, where it asks you what is it a branch of, automatically you should know that it's an artery. Arteries have branches, veins have tributaries, or the word used will be what does this vessel drain into. Secondly, arteries are always colored red, other than maybe pulmonary artery and the umbilical artery, where some images might have them blue because they carry deoxygenated blood. So let's look at this and see where the vessel is going. So if you look at this image carefully, this is the liver, and this is one of the images from the image database that we're supposed to look at. This is the spleen. These are the kidneys. So this artery is the aorta, and here are the branches which come off the aorta. So this one here is the celiac axis. Then the arrow is hiding it. Up here is the superior mesenteric, and down here is the inferior mesenteric. This artery is going towards the liver, as you can see. So I'm going to remove this. And now, if you look at it, the artery is going towards the liver. So this is the hepatic artery. And what is it a branch of? The hepatic artery is a branch of the celiac axis. So therefore, this is the correct answer. Now, if you thought of first of all, this one can completely be taken off the choices because it's a vein. And remember what I said about branch and vessel. So now, splenic artery should go to the spleen, but the spleen is on the left side and this is the right side. So this is the liver. So that's how you should be able to choose your answers. It can't be the celiac axis because you can see that the vessel is pointing to something which is going to this organ. So therefore, it's a branch of the celiac axis. Let's look at the next question. So again, here it's pointing to a vessel which doesn't ask you to identify. So you have to read the question carefully, but it just says, name two blood vessels that drain into this vessel. So first, that means that this is a vein. So anything that drains into it will be a vein. So first in your mind, you must identify what this blood vessel is, and then you will have the answer. So this is the inferior vena cava, and even if you forget, right here itself you can see, look at this, this is from the kidneys, you can see the renal veins going into it. Here, this is the suprarenal on this side, so the suprarenal on the right side drains into it. These vessels which go up like this, these are the gonadal veins. We don't know the sex, so we call it gonadal veins. And then here, of course, you have the common ilia. So, any of those would be choices. Now, in your lab test, of course, you would have to write those down. So that's the way to look at it. But look up here. So it says splenic vein and renal vein. Remember, splenic vein drains into the portal vein. So this is not it. And you can see that you don't see the splenic vein up here. Then inferior vena cava. The vessel is the inferior vena cava. So this is not the choice. This one, it says R3. So obviously, you can discount this. The last one where it says renal vein and common iliac vein. So that is the correct answer. So this one here is the correct answer. So this is the correct choice.